Welcome and good morning, everyone. It's 10 o'clock on this chilly Wednesday morning after our fake spring we had yesterday. Glad to have you along today, where we'll take one more step toward making you Medicare experts, and you'll have your graduation cap, and just like those folks at the bottom of the screen, and move forward here with your lives and your business. My name is Randy Lober, Growth Marketing Manager here at Action Benefits, and happy to have you along for today's session. I'll be leading most of today's call, but also joined today by Debbie Brown, one of our account coordinators on our individual team. Debbie, say hi to the people, please.
Good morning, everybody. Welcome, and hope you all have a great day and enjoy this great presentation Randy's got ready for you.
Thank you, Debbie, for joining us here today. I appreciate your expertise, and I'm sure our audience will as well. In fact, I'm willing to bet here that Debbie and I are experts, and I'm willing to bet that you can't stump us here today on any Medicare-related question, at least. If you can, the first person that can stump us today, I'll buy you breakfast for your whole office. We'll see. Depending on how big your office is, let me head to that bet, I guess. If you're working in an office of 500, I don't know if that's happening, but we'll make a little friendly competition here. Ask all the questions you got. Hit us with anything on your mind, and we'll see what we can do to make you one step smarter here by the time you leave here today. So we are talking Medicare expertise, and what does that mean? We're not talking about like all the normal stuff that happens with Medicare. We're talking about all the weird and wild niche stuff that happens with Medicare sometimes. So we're going to look at those special cases where a beneficiary can enroll in Medicare, not just when they turn 65, but all the other ways you can become eligible for Medicare and where you might find them. We'll take a look at LEPs and how to avoid them, and that's important. They kind of goes hand in hand with enrollment opportunities because if you don't enroll, as you know, when you're first eligible, these LEPs can stack up, and they can stack up fairly quickly. And we'll also take a look at the way that Medicare coexists and coordinates with some private carriers and public programs because we know Medicare is not the only insurance payer or carrier out there in the world. There's a variety of other things that you and your clients will have to consider to find the right coverage solution for them. So we'll take a quick look at those. So if you know who we are and you know what we're doing today, Debbie and I would like to know a bit about you here as well. In the chat, would you please write one of these letters or type one of these letters? Which of these statements best describes you? Is it A, you're brand new to the Medicare market? B, you have experience in this market, but you're new to Action? C, you have some experience with Action in this market, but could use a refresher. Or D, you're a seasoned pro and you just love spending time with Action. You rolled out of bed today and you said, Medicare, Debbie, Randy, three of my favorite things. Got to be there today. Go ahead and put a few letters in the chat for us. Let us know what you're thinking. Lots of love in the chat. We love you too. Thanks for joining us here today. Some folks here for the refresher here as well. So you're in the right place, and one brand new person to the industry. We're happy to support you in your growth here as well. For that brand new person or anyone else needing a broader refresher, do encourage you to check us out on YouTube, where we host and record all of our sessions. We have sessions that are like the 101 of Medicare. You can take a look at those, as well as a variety of other marketing strategies you might want to take a look at here as well. And Mike, you're new to us here today, so thanks for joining. We'll see if we can get you one step closer to Medicare expertise here today. So we're going to spend the first chunk here today talking about enrollment opportunities. Yes, we'll talk about some of the boring old plain Jane ones, but we'll also talk about those weird edge cases that can pop up too, that you'll need to be aware of to help everyone that is or can be Medicare eligible. So this is full disclosure, one of the favorite things I've ever done here at Action Benefits. Really puts all 5 enrollment periods, or 5 of the possible enrollment periods, side by side, talks about who they're for and what they can do during these enrollment periods. After I reveal everything here, I'll leave it on the screen for a moment, just so you can take a screenshot, pin it to your bulletin board. In fact, if you walked around our office, you'd see it on many bulletin boards around here. That initial enrollment period is built for folks who are aging into Medicare, who are turning 65. You as experienced agents know that, though, and you know that they can enroll in parts A and or B as necessary, and enroll in part C or D after they have the right combination of A and or B. And you also know as experienced agents that goes a 7-month window, 3 months before the 65th birthday month, 65th birthday month, and the 3 months after. We're not going to spend a ton of time there. But we'll talk about GEP2, General Enrollment Period, ongoing right now, built for folks who have missed their initial enrollment period. During that time, they can enroll in parts A and or B. And like I said, it's ongoing right now, ends at the end of this month on March 31st. Special enrollment periods can get a little tricky. We'll spend some more time here later today. Generally speaking, folks will be eligible for a special enrollment period based on having previous employer-based coverage, though there are other cases here as well. But you'll most likely run into someone who's maybe aging off of their group plan or aging into Medicare and needs to make a decision here. During those SEPs, they can enroll in parts A or B, and the SEP for enrolling in parts A and B lasts for 8 months from the termination of their employer coverage. AEP, you just got out of the woods with that here. You know that's built for anyone on a Medicare plan, whether that's original Medicare or Medicare Advantage. They can enroll in C or D for the first time if they did not do so during their IEP or change their Part C or D plans. And as you know, it is built for October 15th through December 7th. And the MA open enrollment period, which has its own set of compliance hurdles, which we're happy to work with you around here as well, is only built for those already in a Medicare Advantage plan. It's not for those just on original Medicare. It's not for those on the MedSup and Part D. You must be in a Medicare Advantage plan to take advantage of this period. During this time, you can make a one-time change to your MA plan. And the important distinction between MA OEP and AEP is that you only get one time to do that, right? It's not last app in wins. It's the only app in wins for MA open enrollment, and beneficiaries can take advantage of that from January 1st through March 31st. So you've got, just about 32, 33 more days. I'm not a math major. To take advantage of that. Want to spend some time talking about the initial enrollment period, though. Yes, folks can age into Medicare, but what does that mean? What do they do? There are some cases where the folks will just automatically be enrolled in parts A and B, and that can make it a lot easier. But for those folks, when they do age in, but there's some special cases where that happens. If someone is already getting benefits from Social Security or the Railroad Retirement Board, depending on whether or not they've worked for railroads, they would automatically get Part A and B starting the first of the month prior to the month they turn 65. So if their cards will be mailed to them, they'll be ready to start using Medicare as soon as they turn 65 there. If you are under 65 and have a disability, and there is a growing number of these folks, if we take a look at DSNP enrollments and so on and so forth, if you're under 65 and have a disability, you automatically get parts A and B after you get disability benefits from Social Security for 24 months. So on the 25th month, the first of the 25th month is when your A and B would become effective. Or at any age, if someone is diagnosed with ALS or Lou Gehrig's disease, they would automatically get parts A and B the month their Social Security disability benefits begin. We should point out that if someone is automatically enrolled, the Medicare card is mailed to them, like I said, 3 months before their 65th birthday or during that 25th month of disability benefits, whichever case might apply to them. So that's when all this stuff is taken care for your beneficiary, but most of your beneficiaries may have to take an active step to enroll in Medicare during their initial enrollment period. So if they're approaching age 65, but they're not currently getting benefits from Social Security or the RRB, we'd always encourage them and encourage you to encourage them to contact Social Security 3 months before they turn 65 to begin that enrollment process. Takes advantage of that 7-month window, right? If they're a railroad worker, of course, they'd contact the Railroad Retirement Board, RRB. And of course, always be aware that if they don't enroll in time, penalties are possible. We'll spend some time with those a bit later on. If someone is eligible for Medicare because they have ESRD or end-stage renal disease, their initial enrollment period begins the month they're diagnosed with that and lasts for an additional 3 months. We'll talk more about what they have to do to enroll. But in either case, these folks will need to contact Social Security office in order to take advantage of and enroll in their benefits. So if you're in these cases on the screen, they will need to take some sort of action to take advantage of those benefits to enroll in Medicare Parts A and B. And I stress that because it's time for your first knowledge check of the day. In which of the following cases will a beneficiary need to take action to enroll in Medicare Parts A and B? Write all that apply. I will give you a hint. There are at least 2 correct answers here. Please write as many as are correct. Is it A, if they're already receiving Social Security benefits and railroad retirement benefits and turning 65? Is it B, if they're not receiving Social Security benefits or RRB benefits and are turning 65? C, if they're diagnosed with ESRD at any age? Or D, if they receive Social Security disability benefits for more than 2 years? In which case or cases, hint, hint, nudge, nudge, wink, wink, will they need to take action to apply to enroll in Parts A and B? And if you are saying B is correct, right? If they're not receiving Social Security benefits or RRB benefits and turning 65, yes, they'll need to take action. They'll need to visit the Social Security office. If you're saying C, they're diagnosed with ESRD, they would also need to take action to enroll. And the other 2 cases, A and D, those are both automatic. They would receive their cards as appropriate. So B and C is what you're looking for here. Debbie, anything to add about the initial enrollment period before we go forward?
Yeah, a couple things. Number one, also remember that if you're on Medicaid and you're under 65, you turn 65, you're going to automatically get Medicare A and B. Sometimes we get calls regarding this situation. And then also, if you are on a group of over 20, you necessarily don't have to sign up for Medicare. You're not going to get penalized, especially with the groups now. A lot of your large groups have HSAs. The HSA is where you can't contribute, and that's because you have Medicare, but if it's not, it has nothing to do with your age. So if your group is over 20, you know it's a large group, don't put a panic button into your client and say you got to go sign up right away. You don't, because if you have Medicare and you have an HSA on your plan, you now cannot contribute. So you don't want to take A until you're ready for that full Social Security benefits to kick in.
Yes, absolutely. Great point. You can cancel Part B whenever you want, although that we don't recommend, but you can never cancel Part A once you're in. So that's like an irreversible decision, and you want to make sure your clients are taking all due care and caution when making that choice, even though in a lot of cases it can be a no-brainer. It's not always as it seems.
Hey, Randy, I just want to also add, when somebody does sign up for A after they're age 65, they go on full Social Security benefits. I don't know what the age is now. I think it's 67 or 68 or whatever. You sign up for your Social Security benefits. You're still working. You're like a lot of us that are still working past that age. Don't be surprised. You automatically get A, and they will go back 6 months from that date. So if you are June, full Social Security benefits, they're going to go back to November. So just to let you know, don't have your client panic. Just let them be aware that that's what's going to happen.
Thank you. Let's talk a bit more about general enrollment period, only because this is part of your AHIP, but it's worth refreshing you on, because we get a few calls about, well, I enrolled in January. Do I have to wait till July for the Medicare to be effective? And the answer is no. During the general enrollment period, if someone does not enroll during their IEP, they do have to wait till GEP to sign up for Parts A and B, unless they qualify for a special enrollment period. But the GEP does take place from March 1st through January 1st through March 31st each year. The big difference, though, that's happened in recent years that we still get calls about, especially if you might be an expert, have been around for a while, is they no longer have to wait until July for that Medicare Part A and or B to be effective. The Medicare coverage becomes effective the first month after the enrollment. So if they enroll in March, they enroll on March 15th, their Medicare Part A and or B is effective on April 1st, not July 1st. So big clarifying thing we want to make sure you're aware of here as well. Let's dive into special enrollment periods. Debbie alluded to these a bit ago when she talked about the group size and when you may want to or enroll right away, and when your folks may want to delay that enrollment if they can. So when are folks eligible for a special enrollment period? There's a few different cases here. They may be eligible for a special enrollment period when either the beneficiary or their spouse is actively employed and their employer group health plan consists of more than 20 members, or if they're disabled and working for an employer group with more than 100 employees. They could be eligible for the special enrollment period then. For folks that volunteer and spend their time perhaps in a foreign country doing that volunteer work, they may qualify for an SEP when they return for parts A and B. You'd want to talk with the Social Security office about that to see what that could look like for them. But we do want to stress that people are not eligible for an SEP when retiree or COBRA coverage ends, because it's not considered active or creditable coverage. For Medicare Parts A and B purposes, it's not considered active employment. So if they wait that full 6, 12 months on COBRA or whatever period they choose to wait for, they could find themselves in trouble there. They do not get an SEP, at least a traditional one, either when they're eligible for Medicare based on having end-stage renal disease. Remember, they have their own unique IEP that starts the month they're diagnosed. So be aware of that as well. They don't have the 8-month window there after diagnosis. They only have those kind of 4 months, including the month of diagnosis there. The SEP can be used when someone is covered by a group health plan, inclusive of retiree benefits, and they do need to take advantage of the SEP within 8 months of the loss of coverage or employment, whichever comes first. We should also point out that the special enrollment period we just talked about for Medicare Parts A and B is not the same as special enrollment periods you would see for Parts C and or D, right? So there's special enrollment period that lets someone into the Medicare program, which is what we just talked about. But if there's a change in their Part C or Part D coverage, maybe a plan leaves the area or whatever the case might be, they would have 63 days to either enroll in a new Part C plan, Medicare Advantage plan, or a Part D plan, standalone PDP. I do see your question, Betsy. We'll get to that in just a moment, right after this knowledge check here. In this question here, we're talking about general enrollment periods, the GEP. Which of these following statements is true, keeping in mind that more than one may be true? Is it A, beneficiaries are eligible to enroll at any time throughout the calendar year? B, the period is designed for beneficiaries who might have missed their initial enrollment period? Or C, the period lasts for 8 months from the end of any employer-sponsored medical coverage? And for those of you chiming in with B, you're absolutely right. It is built for folks who have might have missed their initial enrollment period for a variety of reasons here. Debbie, I want to give you some time to look at Betsy's question and add anything else you might have here as well.
Okay, so as far as Betsy's question goes, just keep in mind, I know you said that if Part B is automatic for most, keep in mind if somebody is working, especially in a group of over 20, you're most likely are not going to be getting Social Security benefits. You don't want the government to get any part of your funds, so you're most likely haven't qualified for that yet or applied for that yet. So you're not going to automatically get that A. If for some reason you do get it, then yeah, contact them and before it goes into effect, because like Randy said earlier, once you get A and it's in the system and active, you can't remove A. So I think that answers your question. Does that sound good, Betsy? Perfect.
Perfect. Debbie, anything else to add about GEPs or SEPs before we go on?
Nope, not at this point.
All right, let's keep rocking and rolling. and talk a little bit about AEP. Not spending a lot of time here because you're veteran agents, as you told me earlier. But between October 15th and December 7th, that's when the bread is buttered, when enrollment decisions are made. And you know that during that time, folks can join or switch Medicare Advantage plans. They can go from a Medicare Advantage plan back to original Medicare. They can join or switch Medicare prescription drug plans, or for whatever reason, though maybe not a good one, they could drop Medicare prescription drug coverage completely. So during AEP, they do have a lot of flexibility here, right? In changing most aspects of their Medicare coverage without any penalty or underwriting or so on and so forth. And they do have a lot of flexibility in choosing their drug coverage here as well. Probably the most flexibility they have to choose a drug plan that will fit their needs for the coming year. And that's important because in MA OEP, which is ongoing right now, they don't have that same kind of flexibility because the full name of the period is the Medicare Advantage Open Enrollment Period. During this time, you can only switch MA or MAPD plans, and that's only if you're already enrolled in one as of January 1st. You can also return to original Medicare and pick up a PDP if you choose, if you're leaving your Medicare Advantage plan. But during this time, you can't enroll in MA or MAPD for the first time, or if you're just in a standalone Part D plan, can't make any changes to that Part D coverage here at this time. And there's a lot of folks who might find themselves in their boat. Maybe they missed their annual notice of change, or have gone to the pharmacy for the first time here in 2025 and saying, wow, that drug got more expensive, even though they have the $2,000 cap, and they're saying, hey, wait a minute, there's something I should be able to do about my drug coverage. And the sad truth is, unless they're in a MAPD at the moment or an standalone MA, there's not much they can do until the next AEP rolls around. So there's limited flexibility to change your drug coverage here at this point in the year. And that's important because a significant difference between AEP and MA OEP is that A, beneficiaries have more flexibility in purchasing prescription coverage during AEP. B, beneficiaries have more flexibility in purchasing drug coverage during OEP. Or C, beneficiaries may only return to original Medicare during MA open enrollment. I can't fool any of you. It is A, they have the most flexibility in looking at drug coverage during AEP, which I know a lot of you are having that tough conversation right now with some folks as they maybe go to fill prescriptions for the first, second, third time. They're taking a look at some of the new price tags after the Part D redesign, and they're going, gosh, this hurts. Sorry to say there's not much they can do until AEP rolls around again. Debbie, anything else to add here?
No, everything is good so far. Nothing to add.
All right, thank you. Let's talk about ESRD for a moment here. Remember, we said we are going to talk about some of those edge cases you might find yourself encountering here. And this is definitely one of them, but it's a growing portion of the population. So much so, in fact, that some carriers have unveiled CSNPs, chronic condition special needs plans, specifically designed for folks with ESRD. So it's definitely a portion of the market you want to pay attention to as carriers try to grow their footprint here, because they're going where the demand is and where the demand might be as they branch out in Michigan here. So if someone does have end-stage renal disease and that diagnosis occurs, their dialysis treatments can and should begin right then, but they do have a 3-month waiting period for their Medicare benefits to begin, assuming they go to the Social Security office and enroll, although they can begin immediately under some conditions. So if, for example, a doctor can testify, or certify rather is the better word, that they can administer home dialysis, and the beneficiary can self-administer those treatments, that will waive that 3-month waiting period for the beneficiary. So if they can go to a doctor, work with them, get trained on how to self-administer dialysis, their Medicare benefits can start sooner. During months 1 through 3 of those treatments, though, if applicable, so if they're part of an employer group health plan, that employer group health plan is solely responsible for the care. It's when month 4 happens. If someone was not immediately eligible for coverage because they could not self-administer treatments, their Medicare benefits kick in here. And that kicks off a 30-month coordination period with that group health plan where Medicare becomes the secondary payer. Coverage for ESRD can end either 12 months after dialysis or 36 months after a successful kidney transplant. And coverage can be extended if it's determined that dialysis is necessary again, or another transplant occurs within 36 months of the first one, assuming there's dialysis there in between. So there's some big windows there, right, where they may have Medicare Parts A and or B active in that month 4 on or onwards that they'll pay attention to, but then later on, their coverage could terminate, right? Hopefully after a successful transplant, where they'll need to look at some other options. And speaking of those other options, one of those is relatively recent, where Part B offers an immunosuppressive only drug benefit. And Medicare rolled this out to cover those immunosuppressive drugs, so the anti-rejection drugs beyond those original 36 months, if they were previously enrolled after an organ transplant, and if the beneficiary has no other health coverage with an immunosuppressive benefit. So the beneficiary is not enrolled in a Medicare Advantage plan. The beneficiary is not enrolled in a group health plan. They're not enrolled in a marketplace plan. They're not enrolled in anything else that would cover immunosuppressive drugs. They could be eligible for this little carve out of Part B benefits here as well. The benefit does have a reduced premium, but it's still based on income and tax filing status. So IRMA provides that sliding scale for us there. It only covers immunosuppressive drugs and no other items and services. And we should point out that if someone does take this benefit, it's not a substitute for full health coverage. It does not cover any other Part B services. It only covers immunosuppressive drugs at a reduced Part B premium. So suppose you have a client or a prospect that is diagnosed with ESRD and they have begun dialysis treatments. They're not currently covered by an employer group health plan though. Which of the following statements are true about their coverage? Is it A, there will be a 3-month waiting period for their benefits to begin? B, that 3-month waiting period may be waived if a doctor certifies the patient can self-administer their treatments? Or C, this client is out of luck, they're not eligible for Medicare until they turn 65. Which one or ones of those could be true? You're keying in on B, and that's exactly right. That 3-month waiting period can be waived if a doctor certifies they can self-administer. Otherwise, A is also true, right? There will be a 3-month waiting period for Medicare benefits to begin. Debbie, anything to add about ESRD here before we go forward?
Nope, everything looks good.
Thanks. I like hearing that. It's the best part of my morning. Let's talk a little bit about LEPs then, parts A, B, and D, so we're aware of those and how they can interact with all the enrollment periods that we just talked about. That late enrollment penalty for Part A does exist, but for most of us, we are eligible for premium-free Part A by virtue of having worked 40 quarters, and those quarters, again, don't have to be consecutive, but that is kind of your ticket to premium-free Part A. But if you have someone who is not eligible for premium-free Part A, maybe they or their spouse did not work enough quarters to be eligible for that, and they enroll sometime after their initial enrollment period, they will face a 10% increase to their monthly premium. That penalty is in place for twice the number of years that enrollment was delayed. And that's the number of full calendar years that enrollment was delayed. So partial years do not matter here. Should mention that this is the only late enrollment penalty that can go away while someone is still enrolled in Medicare. Every other LEP is you're stuck with for the duration of your enrollment. So, for example, if someone enrolled Medicare Part A 2 years after being eligible, they do have that 10% penalty added to their base premium, and that penalty is charged for 4 years. Part B is the big one, though. We see a lot of folks, especially who elect COBRA coverage and mistakenly believe that COBRA coverage is creditable, get slapped with a Part B penalty. Though there are exceptions to when you do or do not need to take Part B, this penalty will apply if someone does not enroll during their initial enrollment period. This penalty looks like a 10% increase to their premium for each full 12-month period that enrollment was delayed. And this penalty does stick with you for the life of your Part B enrollment. So as long as you have Part B, you're paying that 10% increase. So if we take a look at Opal here, suppose her IEP ended in December 2019, and she waited to the General Enrollment Period in March of 2022 to sign up. So her coverage would become effective on April 1st of 22, but her Part B premium penalty would be 20% of that standard premium, and it has to be paid for as long as she keeps Part B, because she was not enrolled in Part B for 2 full years. So it can be pretty steep, can add up pretty quick. I would always encourage you and your clients to enroll when they are first eligible, as long as they have no reason to delay that enrollment. Medicare Part D can also, an LEP can also apply when someone does not enroll when they're eligible, or they have a gap in creditable prescription drug coverage for longer than 63 days. And that penalty is determined by taking a look at all of the PDP premiums, finding an average of those to find the net national base premium, and multiplying that by 1% by the number of months uncovered, rounded to the nearest dime. And that penalty is in place for as long as the beneficiary is enrolled. That sounds like a lot of weird math, so let's give you an example for it. I have Tarek here. He was currently eligible for Medicare, and his IEP ended on July 31st of 2020. Has no prescription drug coverage from any source. He didn't join by July 31st, 2020, and instead joined during open enrollment period that ended December 7th, 2022. His drug coverage became effective on January 1st of 2023. Since he was without drug coverage from August 20th through December, or August 2020 through December 2022, his penalty in 23 was 29%, 1% for each of the 29 months he was uncovered, of $32.74. So 29% of $32.74, which was the base premium for that year, or $9.49. It's always rounded to the nearest dime, so he paid $9.50 in each month in addition to his premium. So the math on that, again, is that 29% penalty times the base premium gives you the $9.49 to the nearest dime is $9.50. And that was tacked on to his Part D premium as his late enrollment penalty. Now, where this can get more expensive and can add up quickly, though, is the national base premium is recalculated each year. So if we look at the same math again for 2024, the premium goes up to $34.70. So I've got 29% of $34.70, leaves me at $10.06. Multiply, round that to the nearest dimes is $10.10. His penalty has gone up because he was uncovered for 29 months there. He's tacking on $10.10 to his monthly penalty. That doesn't sound like a lot, especially when you look at premiums that are currently in the $80, $90 range, right? Depending on the PDP you're looking at. Others, of course, we know are cheaper, but also with PDPs, you sometimes get what you pay for on those formularies. So always be mindful of that, that once you get that Part D LEP, it's with you for life, and the consequences can add up quickly, especially as premiums continue to edge ever upward, because they don't go down, generally speaking. That puts all three side by side. I would encourage you to remember that Part A does go away. Parts B and D do not. They can stick with your beneficiary for life. So it's always important that they seek you out for good counsel and you provide a good counsel about timing their enrollments. By the way, the only late enrollment penalty that will end while the beneficiary is enrolled in Medicare is it A, the Part A penalty, B, the Part B penalty, or C, the Part D LEP. Which one will fade away while you're enrolled in Medicare? Go ahead and put a letter or, well, just one letter actually in the chat. And if you are saying A, as most of you are absolutely on track here. That's the key thing to remember here. Everything else you're stuck with for life. Debbie, anything else to add about LEPs here?
No, I just want to make sure, like, if you get your clients coming in, they've never had a plan, it's AEP, and they're freaking out because they have that LEP now on their Part D, just remind them, they go on the essential plan or any of the like priority health plans that have zero premium. they're still only going to pay $10 or if that's what their thing is or whatever it is. So the late enrollment penalty will not only be on your PDP plan, but it also will be on the any MA PD plan. So keep that in mind and try to encourage them to stop that bleeding. If you're not good at math, not like Randy is great at math, just a reminder, there are calculators out there. If you Google Part B late enrollment penalty calculator or a Part D calculator, great calculators out there. That's what we use a lot. So you can give them the rate pretty much close to what they're going to be seeing.
Thank you. Great reminders to have, especially if you are not mathematically inclined. I had to fudge my way through calculus and those sorts of things going forward. But simple multiplication, percents, we can figure that out. Let's also talk briefly about med sups. We do get a lot of calls about, hey, does my client have a GI right here? Are they entitled to enroll without any medical underwriting? Want to make sure you're experts in that here as well before we close the day talking about coordination. So generally speaking, your client, well, not even generally, just always speaking, your clients are eligible for their supplement open enrollment period during a 6-month window that begins when they are both 65 and have parts A and B. They do also have guaranteed issue rights that can begin when special circumstances apply, typically coming along with the loss of employer group coverage, where they can enroll in a Medicare supplement plan without any underwriting applied. Outside those two instances, though, they are in a non-guaranteed issue period where beneficiaries can be charged more based on their medical conditions. They can even be denied coverage if they apply during this period. Some carriers do offer guaranteed acceptance. Blue Cross Blue Shield of Michigan, for example, will accept any application outside of the guaranteed issue period. They will still upcharge, but they will not deny a coverage. In that case, other carriers may flat out deny or uprate your clients based on how they answer those medical underwriting questions or anything else that's unfound in the underwriting process. So always be aware of that as you go forward. But generally speaking, the best way to avoid late enrollment penalties and ensure access to the widest variety of medical plans is what? Is it A, sign up during initial enrollment period, B, sign up during your initial enrollment period, or C, sign up during your initial enrollment period? Which one would you advise your clients to do? Thank you, Michael. Yes, all things considered, right? Unless there is something else that would give them a good reason to delay enrollment. Maybe they're employed by a large group, right? So they don't need to enroll in Medicare Parts A and B right away. Always a good idea to sign up when you first are available. Takes care of LEPs. Make sure you have a wide variety of Medicare supplements options. Being a little cheeky with you here today, making sure you're paying attention. Glad you are, though, for the record. Debbie, anything else to add here about med sups, enrollments, or anything else before we go forward?
Yeah, with med sups, keep in mind that if you're outside of the 6-month waiting or initial enrollment period, and now it's the carrier's renewal, such as right now we're going into Blue Cross's 4-1 renewal, that does not give you the right to enroll a member as a GI enrollment. We get a lot of calls thinking that, hey, now it's renewal time for Blue Cross. Can I switch my member to a different plan? No, once you're past the 6 months, you're going to be medically underwritten no matter what. I would highly recommend never to give up on enrolling your member into a different plan. With the supplemental plans, you can enroll change a plan every month, whatever as long as you can pass through underwriting. Check with the other carriers. Put an application in. Don't cancel what they currently have. Put an application in. Humana, United Healthcare, Priority Health. See if they pass underwriting. Maybe they'll get a tier 1 or a tier 2, which will be still cheaper than what the Blue Cross is showing right now. It might be good for you. I've seen it happen many times. So it doesn't hurt to try.
The other thing we should point out while we're talking about Medicare supplement plans, right, especially if folks are shopping around for rates, we do have some partners here from McLaren Health, so I want to shout out their offerings here as well. We should also point out that some carriers do offer really simplified underwriting here in this market. Wellaby, formerly Medico, for example, offers 2-question underwriting for Medicare supplement plans, height and weight. And if you fit into their build chart based on where you go there, regardless of any other conditions, there's good chance you can make it into that, that their tier 1, their preferred rate, so long as you fit their definitions on the build chart. So, and really they start uprating once your BMI, like my back of the napkin math works out, hits like 30, 31 or so. So if BMI under 30 or 31, could be a good option for someone who might otherwise have conditions, but is looking to rate shop there as well. Talk to us if you have more questions about it. Let's end today talking a little bit about Medicare and how it coexists and coordinates, and when it doesn't play nice in the sandbox with others as we go forward here. Should point out, and this is experienced agents, but just so we're all level set here, every source of health insurance you can have is called a payor. When there's more than one payor, coordination of benefits rules, in this case, they're decided by Medicare, will decide which payor pays first. You may have primary payors, you may have secondary payors, and in some cases, depending on all the sources of coverage someone could be eligible for or have, there could be tertiary or third payors here as well. Haven't got down to fourth or quaternary payors yet, but I imagine that's possible depending on how they carry insurance. This is a handy chart worth screenshotting, also putting on your bulletin board, simply because it lays out in black and white how you can expect Medicare to behave with some other common benefits. If someone has retiree coverage from their employer group, that coverage can coexist with Medicare, and Medicare will be primary in that case, so long as they have no excluding conditions, like the black lung. Medicare will not pay primary in that case and may not coordinate. If they're on an employer group health plan, whether that plan it belongs to themselves or the spouse, that coverage does coexist with Medicare, and Medicare will pay primary if the employer has less than 20 employees. If the employer has more than 20 employees, Medicare will pay secondary in that case. If someone is eligible for Medicare because they are under 65, disabled, but also have an employer group health plan, that does coexist with Medicare, and Medicare will pay primary if the employer has less than 100 employees. That should say employees, not employers. If the employer has more than 100 employees, Medicare will pay secondary in that case. If someone has ESRD, end-stage renal disease, with an employer group health plan, that does coexist, and Medicare will pay primary after that 30-month coordination period that we talked about earlier. Someone has Medicaid, Medicare will pay primary there. Medicaid is always the payor of last resort. We should also point out that balance billing is illegal for QMBs or qualified Medicare beneficiaries there as well. If someone has marketplace coverage, Medicare does not coexist. Medicare will not pay because Medicare eligibility disqualifies you for tax credits and other savings on the marketplace. That is Uncle Sam's friendly reminder to your beneficiary that if you're eligible for Medicare, to stop taking marketplace coverage, to go enroll with Medicare, so long as you are eligible for those cases. So let's take a look at Hector real quick, and we want to take a look at veterans coverage here in just a moment here as well, but let's visit Hector. Hector is 64 and 9 months. He's employed with a small 8-person web design firm. He's enrolled in that group's health plan and will enroll in original Medicare during his IEP. He wants to keep working till he's 70 though. Which of the following statements will be true regarding his medical coverage? Is it A, Medicare will pay primary for any medical expenses that Hector incurs? B, Medicare will pay secondary for any inpatient hospital expenses he has, or C, there will be a 30-month coordination period between the employer plan and Medicare. If you are saying A, you are correct. Medicare will be the primary payor in this case because of the group size. Debbie, can you take a look at Lisa's question there and share your thoughts?
I actually don't know, Lisa. Alls I know is if they're on Medicare or age 65, they won't get the tax credits. And as far as being eligible for marketplace, you're still on Medicare. So whether you're paying for it or not, you're still on Medicare. My suggestion and my experience with working with the marketplace for how many years now is you're better off once you're on Medicare, any kind of Medicare Part A, whether you're paying or not, you really need to be on a Medicare plan. You shouldn't be staying on the marketplace plan because you're going to have we've seen several claim issues and they can't figure out who's paying what, where it's not being processed correctly. And then the member could possibly get taxed a big bill or get a big bill because it didn't get paid properly down the road. Could be a couple years down the road when an audit's done. Remember, Medicare does do audits. You see if a member's not right, then my suggestion to agents when you talk to me, as soon as they say they're 65 or going to be 65 on marketplace, get off of it. Just get off of it. So
The other thing
that makes sense.
I might add there is there are those edge cases, right, where someone maybe isn't eligible for Medicare. They are 65, but they're not eligible for Medicare because they haven't been here for 5 years, or they're not yet citizens, right? They're not yet legally present. In those cases, they'd still be eligible for marketplace coverage because they wouldn't be eligible for Medicare, but it's the Medicare eligibility that triggers that here. Yeah, and just clarify that here in the chat as well. Let's talk about veterans coverage real quick and the variety of sources that veterans may be covered and whether or not they play in the sandbox with Medicare. Well, we should take this straight from the horse's mouth, is that the VA does strongly recommend every veteran does enroll in parts A and B when they're eligible, and that's for a variety of reasons. Whether because Congress chooses to, or the executive branch chooses to, or somewhere in between, VA health coverage isn't the same for everyone. It's not always funded the same way. The same benefits aren't always funded the same way, and you can be grandfathered in or out of benefits as Congress chooses to fund those. So enrolling in both greatly expands their options, right? Enrolling in both Medicare and VA coverage greatly expands their options because they can get treatment under either program when they enroll. VA benefits can be used at VA centers or at a pre-authorized non-VA location, and Medicare benefits can be used anywhere that takes assignment at any participating provider. And they may pay for non-VA covered services at a non-VA location. So that's something else to keep in mind here as well. The other thing you'd want to protect your veterans from is LEPs, right? LEPs could apply for Part B in the future if the VA benefits are lost or if someone wants to seek more choice and options. We should point out, though, that the VA does count as creditable drug coverage for Part D. So there's no penalty if you don't enroll in Part D when you are taking VA benefits. In fact, a lot of veterans choose to enroll in MAs without a Part D benefit because they want to keep that VA benefit here, drug benefit in place for themselves. Tricare for Life is a military, it is a program built for military retirees and provides coverage for both those retirees and their families. If the service is covered by both Medicare and Tricare for Life, Medicare will be your primary payer. If Medicare does not cover the service, Medicare will not pay anything on that, but of course TFL will. But if someone does get services in a military hospital or other federal provider, TFL will pay first, and Medicare will generally pay nothing in that regard. However, again, if they choose to have Medicare, choose to take advantage of some of those benefits, then of course we'd have to, they have more options in choosing where they get care at. Let's take a look at Joseph. He is 89. He's also our last knowledge check of the day. Joseph is 89 and he's enrolled in Original Medicare, Tricare for Life, and VA benefits. he is hospitalized in a non-VA facility for a condition not related to his military service. What will be true about the Medicare covered care that he receives? Is it A, the VA will be the primary payer, Medicare will pay secondary. B, Medicare will be the primary payer, and for TFL, Tricare for Life, may be a secondary payer. Or C, Tricare for Life will be the primary payer, Medicare will be the secondary payer in this case. And yep, we're right. Medicare is going to be the primary payer in this case. Just helpful to be able to tell Joseph exactly how his benefits could work as he comes to you and has questions about them. In the last few minutes, we'll talk a little bit about Medicare and COBRA here as well, because if it's not the most common call our individual team fields, it's probably in the top 3 or 5 or so. So let's talk about COBRA. The Consolidated Omnibus Budget Reconciliation Act, or COBRA, does entitle workers and their families who lose health benefits to choose to continue those group health benefits for a limited period under time under certain circumstances, like voluntary or involuntary job loss, a reduction in their hours worked, transition between jobs, or death, divorce, and other life events. In general, COBRA does only apply to employers that have 20 or more employees. And COBRA coverage is generally offered for 18 months, 36 cases in some months, especially in the case of divorce or something of the sort, where that coverage can extend. So let's take a look at what this might look like and what their journey could look like. Suppose someone has a life event that does lead to COBRA eligibility. They're losing their employer group health plan. If they enroll in Medicare while on COBRA, so have COBRA first, then enroll in Medicare, they're going to lose their COBRA eligibility when they enroll in Medicare. But if they're enrolled in Medicare before they take COBRA, they can elect COBRA even if they're only enrolled in Part A. But to avoid a Part B late enrollment penalty, they should enroll in Part B before they enroll in COBRA. The Part D LEP may be avoided, though, if the COBRA coverage is creditable. So if the employer had a group prescription plan that offered creditable coverage, the Part D LEP is not in play here. But the important thing to remember is that COBRA does not count as active employment, does not count as active coverage. So if your client does take that full 18 months, they will not have of COBRA, they will not have a special enrollment period to enroll in Part B once COBRA coverage ends. And gosh, that's a difficult place to be. Debbie, anything to add about COBRA or VA veterans coverage before we wrap up here for the morning?
Well, with the VA benefits, yeah, if you did everything great with that, explaining that, if they have VA, they can have an advantage plan. Because VA benefits you're only going to use in the VA facility or something that's connected with the VA facility. So a lot of agents or a lot of clients will enroll in like a 0 premium MAPD plan. They get the little extras and they can use it outside of the VA facility. If you're on Tricare for Life, I have experience with that with my husband. It's actually one of the best plans out there because Medicare is primary, Tricare is secondary. If they do add an MAPD plan, and I'm sure there's a couple people on here that can voice that I'm saying correctly, it could change your benefits because now your MAPD plan would be your primary. I actually was going to change my husband, read into it a little bit differently. He doesn't want to change anything because he likes the fact that he goes to the doctor, everything's covered 100%. He doesn't have to worry about anything else. So as far as COBRA, the most questions that we get from agents is, hey, my members going to COBRA, they only have A. Do they have to sign up for B? Well, keep in mind when you're on COBRA and you're on Medicare, Medicare is primary. So if you don't have B, what are you going to have? That's the key that we have. If they go past that 8 months, now they're going to have to wait for that general enrollment period for Medicare. So if it's August and they're in their 10th month and they decided they don't want to pay anymore, or they lose their COBRA benefits, it's after the 18 months, it's now August, they have to wait until the next GEP, which is January 1st with a 2/1 effective date. That's a long time to go without any Part B coverage. So be very explicit with your clients when they're in that situation, then highly recommend they do that Part B enrollment.
Thank you. So where do we go today? We talked a bit about some special cases where beneficiaries can enroll. We talked about LEPs across parts A, B, and D, and we talked about Medicare and how it can coexist with both private and public coverage that's available out there. So we talked about all 5 of these enrollment periods because Medicare is so easy to access that it needs 5 different enrollment periods. Tongue firmly planted in cheek there, but you have a handy reference for you to use going forward here. We also talked about these LEPs. We talked about how Part A is the only one that goes away. Parts B and D can stack up quite quickly as someone goes uncovered for more than 12 months. So we want to make sure we're protecting clients from those here as well. And we also talked a bit about how Medicare can coexist with these variety of public and private programs. And when Medicare will pay secondary or primary, which helps to explain why you may want to seek out those additional sources of coverage when they are enrolled in Medicare. Debbie and I, on behalf of Action Benefits, do want to thank you for your time and attention here today. We always love spending time with our agents. We know you got something out of it here based on some of the activity here in the chat. Shortly after you leave today's session and in the follow-up email, you'll see a little survey asking you to tell Debbie and I how we did today. Do appreciate you filling that out, giving us some feedback on whether we met your expectations, exceeded them, or maybe fell short here today. Always love hearing from what you have to say. Always do encourage you to talk to anyone here on the Action Benefits team here as well. You can follow us at LinkedIn at the Action Benefits Company. You can get in touch with me, Chelsea, or anyone here at Action by learning at actionbenefits.com. Or you can find our main line at 248-356-8585. Debbie, before we sign off for the day, do you have any parting words here for our folks?
No, just thank you for visiting us today on this webinar. And also remember, there's 8 strong people on my team, all knowledge just like me. So they're very good at what they do. Answer any questions. If you have anybody you want to contact, you can call or email individual@actionbenefits.com and we'll take care of you. Thanks for joining us.
Thank you, Debbie. Thank you to everyone. Thank you, Jim. Thank you, Michael. Thank you, Lisa, for thanking us. It's just a whole lot of thinking going on here in this last minute of our time here today. I always enjoy spending time with all of you here today. Should you have any questions, please reach out to us. We are happy to help you however we can. We also look forward to seeing you again at another Action Academy session. The training calendar actually should pop up on your screen momentarily. Got a whole March full of stuff you might be interested in. Look forward to seeing you all at any and all of those as they come up. Enjoy the rest of your day and stay warm out there after our little fake spring we had yesterday.